Thank you. It's really nice to be here. I was delighted to have the invitation, and hello to everybody online as well that's listening in. So as Patrick said, I'm Linda Bald. I'm a professor of public health at the University of Edinburgh. I also am an advisor to Scottish Government. And I'm going to tell you a little bit about a large new ESRC investment. And I suppose I'm here today to learn as much as possible about access, which I know the ESRC regards as a flagship investment, very innovative in the work that you're doing. And I hope that we'll have a bit of time for discussion. So I'm going to speak for sort of 15, 20 minutes, and then we've got time for discussion. And if there are any tough questions, my colleague, Professor Nick Pidgeon, sitting in the front row, is a co-investigator in BR UK, so you can ask him the tough questions. Great, okay. And so Patrick asked me to think about a relevant theme, and I wanted to connect what you do, the important work that you do, with what we aim to achieve in BR UK. And what we're doing is a lot of empirical work, but we're also very much focused on building capacity and capability in the discipline. So I'll tell you about what the investment is and some of the things that we're doing now and have planned. And we started in November. So the first thing, and we were discussing this at lunch actually, what on earth is behavioural research? You could argue that all of the social sciences do behavioural research to one degree or another. But there are some distinctive elements, and there are also distinctive disciplines that I think contribute or have traditionally to what behavioural research is. But the key thing is it's not just looking at human and organisational behaviour, it's systematic investigation of that behaviour to produce new knowledge and also theoretical understanding. So for us, the use of models, concepts and theories is very important. It underpins all that we do. And then also using querying and replicating existing knowledge, so we do that, and then looking at implementation of research evidence. And I think that's a key area that is under-researched. All of you will know across the sectors that you work in, we talk about the implementation gap. I'm not always convinced it's that real, but evidence is not used in practice in the way that we would wish, and there are behavioural reasons for that in context. The second thing is that there is a very broad concept of behaviour within the field, and there's a recognition that it's complex. Again, we were discussing at lunch, if you ask somebody on the street what do they think behavioural research is, they'll probably tell you something that's a bit about nudge. You know, it's either about choice architecture or trying to do, marketing companies trying to do something dodgy to persuade people to sell buy their products. But it happens within systems. So how we behave is a function of where we come from, our backgrounds, the situations that we find ourselves in, the opportunities we have available, how motivated we are, and also the structural constraints that we face. So understanding context is key, and we also need to understand processes of change. So what happens through time and how that varies between people, places, and other characteristics. And I'll give you some examples of the studies that we're doing. We need to look at the sustainability of behaviour. So in my own field in public health, I've done a lot of work on addictive behaviours. Long-term behaviour change is really difficult to sustain. And so looking at that and scale up. And then finally, of course, in the current context and across time, making sure that we're thinking about equity and justice. And I think that's particularly important now because we live in very challenging times. Here in the UK, this is a UK investment, but if you look globally, the situation in many places is worse. So why do we need to build capacity and capability, and why are the ESRC funded in this, interested in this? So the first point that we made in the proposal, but I think is the case, and you probably see this in your own fields, is that behavioural research is really fragmented. And there's lots of different disciplines and sectors, so it's quite a cluttered landscape. A couple of the previous consortia I've been involved in were about trying to bring the field together so that we could work with policymakers more effectively to say, these are the big questions that you need answered or partially answered, and here's how research can contribute to that. So we reduce some of the unhealthy competition that often happens in academia, which I don't think decision makers find very helpful. Behaviour, and this is the big one, is often perceived as being about individual choice. We make a decision. The whole debate about healthy eating is a great example of that, and that's not the case. And then the third point, which I think Patrick already made when you talked about the funnel or the pathway of disciplines and evidence, there's definitely a hierarchy of evidence that we're all working within. I sit in a medical school as a social scientist. It's very obvious to me that the work we do often isn't regarded as the same quality or importance as other clinical areas, for example. And organizations that could benefit from behavioral research may not be aware of it or have the routes or resources to access it. So I'll give you an example. We're in, as Patrick said, an election period. And one of our colleagues, her son is working for a candidate. And he's a graduate. He did psychology. And actually what he's doing is in the polling and the discussions, qualitative work, focus groups, etc., with potential voters, they're looking at the behavior or knowledge, attitudes, motivations of the public. But they don't think of that as behavioral research or applied to behavioral science. So again, it's just an area where it's not always well understood what route it could play. That's probably not the best example, but it's the current one. So the funder, this is their initiative, and we are just a part of it, decided, particularly coming out of the pandemic, that there was an opportunity to try and increase the scale of the field and the value of this area, and to connect what we already do and build that capacity and capability. Of course, to do it in an interdisciplinary way, and I'll tell you a bit about the disciplines in our hub, and then to, of course, use research to improve decision-making and to build a larger group of researchers. So in the first component of the investment, they've funded us as a leadership hub, but also importantly, a doctoral training centre plus, which is led by the University of Birmingham, and we'll have very large numbers of PhD students. They're funded for 7 years versus our 5 because of the time that it takes, of course, for the students to complete. So that's a fantastic development. So moving on to what we are focusing on, these are words that we all use in research proposals, but they do mean some things to us. So again, I talked about reducing some of that competition, integrating the field and coordinating what we do, being very inclusive and collaborative. And for me particularly, I was extremely keen that we had all 4 nations represented and that we could do good quality behavioural research in all parts of the UK. So these are the universities that are in the hub, and I said I would mention some of the disciplines. So the kind of traditional ones that you think of for behavioural research are behavioural economics, so we have that in the hub. Many different parts of psychology, so we have a pretty significant number of psychologists. In public health, we've done a lot of behavioural work, so there is quite a big focus on health in our hub. We probably need to be much more diverse, and we've got a number of other areas as well. And then we've got people who look at organisations and occupations, people who look at crowd behaviour, large groups, and people who come from computer science and big data backgrounds. So lots of different fields. So the co-investigators from outside of academia, we have a pretty significant number. So I spend 3 days a week in Scottish Government. We have a small behavioural team there, so they're represented. We have Public Health Wales, who've done fantastic work. UK Health Security Agency, which of the UKG departments has probably one of the larger behavioural teams. And then a really interesting company that works with transport, called Transport Research Lab. And Zinc, which is a small company that works with startups and scale-ups, who are increasingly interested in health and the environment and how they can use behavioural research. And then Nick has a long-standing experience of working with Welsh Government, also another co-investigator in Wales, so they're part of it. Northern Ireland, ADR UK, so looking at administrative data research, and then some of the other partners there. So it's a big group, but hopefully some interesting opportunities. So getting down to some of the specifics now, how are we organising our work? So the figure that you see with the bars, the horizontal ones are how we do things, and the vertical ones are what we plan to do. So we have work packages around capability building, data and technology, of which there's a lot in this space that we need to explore. Looking at methods, but also evidence synthesis, so bringing together evidence for decision makers. And then a work package, of course, on involving the public and stakeholders. And then the themes are around environment and sustainability, so that's co-led by Nick and also a colleague at the Bartlett Institute at UCL. Health and well-being, resilient communities, which you kind of wonder, what does that mean? That was the theme where I thought, what do we call this? But in the first instance, we're focusing on child safety online. We've got collaborators who work on child sexual exploitation online, but child safety generally with Ofcom and others, and also transport, sustainable transport. But we will expand to other fields. And then finally, organisations, markets, and the economy. We've got an economist who works with the Bank of England and others in the hub. And then I won't go through the governance structures, but you have similar groups across access. and just trying to make sure that we've got an international advisory group, which we do, and a number of others that will organise our work. And I'll touch on some of the different elements. So we've organised our activities, thinking about those work packages and cross-cutting themes, into 3 big chunks. So the capability building, and you can see the elements there. Research, so the empirical work that we do. Knowledge mobilization, and then our equality, diversity, inclusion, and intersectionality, and also co-production. But let me tell you a wee bit about some of the different things here. So I'm going to explain in a moment about a national study that we're doing to map the field. And from that, the intention is to build a UK behavioural research network with people outside of the hub will be members of, have access to training, resources, a biennial conference, etc. Training our own staff and colleagues within the hub and learning from them, and also with those partners having placements 2 ways. And then in research, we're working on trying to build even more consensus definitions of the terms that we use in behavioural research. And we're using ontologies that I'll touch on, do some demonstration projects, and then plan the work across the work packages and themes. We've got an open science site. We're committed to pre-publication and registration of all of our protocols, and obviously the research that we do. And then one of the things I'm very keen to learn from Access about your flexible fund, we have a very similar program that we'll be launching in 2025 to colleagues outside of the hub. Just a couple more points on there. This Ask BR UK service. So one of the things that I often find in government is that my ScotGov colleagues sort of have a question which might be relevant to things that behavioural research could answer. So it's a bit like a free consultancy service where people can contact us and ask a question. We have a meeting with them, maybe point them just in the direction of some literature, or maybe do a rapid systematic review, or alternatively, it might be a longer-term collaboration. We might decide to put in a proposal. Governments can ask us to do things. We're working on a rapid commission now for Go Science on a public health topic with a 3-week turnaround. And then the links that I mentioned. So the scoping study is still open. Now, if you're interested in this, at the end of the presentation, there's a QR code that takes you to our website, and that will give you a link to this study. What we said to the ESRC we would do, because they are going to be, if budgets allow, investing in other spokes for the national capability, so there will be further initiatives. The first question you need to answer there is, what are the gaps? We know what some of the gaps decision makers want answered are, but in terms of the field, where does it need to grow? So this is the overall couple of questions that we've got in the study. And that's actually the QR code there for the survey, but there's another one at the end. And further questions we've got in there, in what areas do people want to strengthen capability? What are the gaps? What are the societal issues that are being addressed now? I mean, do we have a gap, for example, around the criminal justice system, or other elements of things in society that could be strengthened? An important one, and I know you've been thinking a lot about this in Access, is how representative of society are people engaging with behavioural research or doing behavioural research, to which the answer is probably not very much, or not as much as they could be. So how do we make sure we expand that? And where can we do better now in the future? So what are the big technology or societal or economic challenges that are coming up that we need to prepare for, where we could make a contribution broadly in the field? And then just as a useful tool, in terms of the findings of this, which we've already started to build from desk-based research of strategies, but also looking at the responses, we've had about 600 responses to the survey so far, is to have an interactive map. So people can see where are the companies that are really focusing on this, or the universities that have strengths in this area, and what kind of research are they doing, or the government departments. So that serves as the basis, as I mentioned then, for this national network that we'll be opening up from probably later this year, actually, that we hope people will find really useful. And connecting that, importantly, with some other similar networks that exist in other countries that we can learn from, including in the Global South, where there is some excellent work that's growing. So just for a couple of minutes, I wanted to tell you about the projects that we're doing now, that we've started in the first 6 months of the hub, in addition to the capability scoping study. So the first one we thought we would do was coming out of the pandemic. I don't know if any of you listened to the inquiries, which of course are still ongoing, But there was a lot of discussion about behavioural research there, and the whole behavioural fatigue concept, and a lot of debate, and it's quite controversial and continues to be a very difficult process. So we thought we'd look at how behavioural research was used during COVID-19, looking at the reports that were produced by SPI-B. Some of our colleagues were part of that group, and to what extent that advice was actually taken up by government, or was it ignored? What were the reasons for that? So that's the first project. The second one is looking at individual variability. So this is experimental psychology experiments online with a representative sample of the UK population. So if you're faced with an issue, banning disposable vapes, looking at behaviours around transport, for example, or recycling or other issues, if you're presented with evidence or anecdotes or different types of material, how does that change people's views? So how do they form beliefs based on different types of evidence? The third one is TRL, so they'll be looking at several components, but including on-road testing. So how do different behavioural interventions affect the speeding behaviour of drivers? The fourth one is looking at ontologies, and we've got a webinar on that coming up that I'll mention. And then the final one, which I've got another slide on, which I thought might be of interest, and please don't ask me any tricky questions about this because I've read the protocol and I've talked to my colleagues who are doing it, but not me, is looking at an environmental and individual behaviour change survey. So some of you might know about the EPIC survey. It's quite a big, big survey. So if you're interested in any of our protocols and you want to find out more, just go onto that Open Science Framework site. So finally, this is the work that, so this is Professor David Shipworth at UCL at Bartlett, who's leading this demonstration project. So attitudes and behaviour from data collected in 2022 in relation to residential energy use and the other points that are on the slide. It's a large data set, so there's over 17,000 respondents in 9 countries. And essentially, they're doing 2 things in this study. They're building personas to look at how different groups of individuals, what their characteristics are in different countries, and what their attitudes, beliefs, knowledge, and behaviour are about energy use, transportation, and food consumption. So using multi-level latent class analysis as the analysis approach, and looking at how these groups vary between countries, as I said, demographic factors, and how that influences their support for environmental policies, to try and push the barriers a little bit more on how we can make useful comparisons. So I hope that's interesting, and it's just starting that project. So if people have any views on the protocol or things they want to contribute, they'd be very welcome. So last couple of slides. This is our next webinar. We've already had a couple of them, and we'll be doing them every couple of months. So do look out for those. They last about an hour and a half, and they've been very well attended so far. The next one's on ontologies. And that's it, really. I just wanted to give you this general introduction. But yeah, looking forward to the discussion today and the rest of the presentations, not me, more importantly, and learning from what you're doing. So thank you. So we've got a few minutes for questions or anything, any thoughts that prompted, or anything you want to share from Access. You'd welcome that. Nick, anything you wanted to add just before we end? No?
We just see if there's any questions online as well.
We got one right here.
Okay, great. Over to you.
You mentioned the sort of relationship between behaviour change, nudge and so on, and the more kind of transformational change that social sciences might bring, or insights into that. And that's been an ongoing discussion within Access for the last couple of years. I was just wondering if you could say a bit more about that and how that kind of dynamic, you see it playing out in different settings.
You mean the sort of public views about nudge?
No, more about the appetite for change within government, particularly, I suppose, where the relative nudge is a relatively safe space. It's working within current paradigms and nudging people towards the sorts of things that the government wants us to do. As opposed to many of the climate nature issues require much more transformative change across societies and economies and politics and etc. And yeah, just how you see that sort of dynamic playing out.
Well, I'll use a practical example that you'll be very familiar with, which is the heat in buildings consultation in Scotland. So we launched, again, not my area of government, but we launched a very large consultation about new legislation in Scotland, which is, quite transformative in terms of how private and individual dwellings and rented sector, etc., what the requirements would be looking ahead to 2040, etc. And we've had a discussion with the consultation team and the behavioural team in government around the fact that some of the tools and techniques that the team are thinking about are around communication campaigns. That's going to make zero difference, quite frankly, to some of the things that are required. It's about the cost to households. It's about further legislative framework. Essentially, it's about changing the environment around the choices that people have available to them. So I think that we've got some distance in that conversation. I think there's some things we can do. So for me, that's a difference between a really well-meaning policy team thinking if we could just educate the public a bit more, that we would see change. But actually, it's much more complex than that. So I think there's an appetite. One of the big barriers is just time. And also getting research done in government is tough, A decision can be made and there isn't time to have a well-designed study or to wait for the findings because the pilot's already been rolled out before you've actually got findings from the study looking at the policy pilot. But I have to remain optimistic, otherwise I'll give up.
Yeah, Gary, off you go. Yeah, I'll help you, Linda.
Thank you very much.
Off you go, Gary.
So I was really interested in what you're saying about how...
Gary, could you introduce yourself?
Sorry, University of Surrey. Yeah. I was really interested in what you're saying about how behavioural research has tended to focus on individuals, neglecting that kind of systemic thing. And one of the kind of aspects of the systemic nature of this is the kind of politicisation of behaviour and the focus on, in the sustainability world, green choices or individual choice or consumer choice, this, that and the other. Are you going to be looking at the kind of political sciences aspect of where behaviour, how behaviour gets framed?
I think some of our colleagues were. So, Gary, that's a good question. And depending on the colour of the political party, sometimes they have a more or less understanding of this. And it is, so in my own field in public health, it's highly politicised. We've made no progress in addressing overweight and obesity for several decades now because most of the political space is still occupied by, oh my goodness, we couldn't possibly do anything on food marketing because that would, if we could just teach children to cook in schools, we'd sort it. So I think, absolutely. So we only have one political scientist in the hub. I would welcome more contributions from political science. I think it's a really interesting way to look at the issue and really unearth some of the reasons why things don't progress because of that kind of agenda.
We mentioned our guiding principles. I guess you're quite close to policy, so how much are you going to intervene and disrupt, or how much are you hoping to just enable? That's always an interesting tension. We'll probably talk about it later this afternoon in our science policy section. So.
I think well, for me personally, I have to be very careful with signing the Civil Service Code, but I think it's more about my colleagues, those introductions that we can make to the other colleagues in the hub who are then able to come in with an independent academic perspective and really provide that challenge. And we've got some excellent colleagues who I think are unafraid to do that, and hopefully there'll be some listening that happens from time to time.
Kate's got her hand up and then we'll go to Pam. If you could introduce yourself, please.
Kate Birmingham from the University of Surrey. It kind of links it a little bit to Gary's question. So didn't see any sociologists mentioned, and there's obviously a fairly long-standing debate about whether or not we should kind of frame these things within a kind of behaviour paradigm or whether we should think about social practices. And I just wondered whether it was a strategic choice for you to kind of position this as behavioural research, because that kind of framing of it sort of works with government, or whether you or whether it's more than that. Do you kind of take the idea of practices on board, or is that not something you're working with at all?
So I think we have to be quite careful in terms of what our place is in a very busy field. Now, we do have at least a couple of colleagues with a strong sociology background who come from that tradition, but the call was very much for behaviour. So I think we've gathered together a group of colleagues who wouldn't necessarily all describe themselves as behavioural researchers and bring different disciplinary perspectives. So I think it's about recognising those distinctions. But yeah, essentially we've responded to what they were looking for. I don't know what your view is, but I think behavioural... so to give you an example, back to government, there was a debate about renaming the whole social research profession in government as the social and behavioural research profession. And that's a very new development. So I think, and that's why I'm really keen that we get the definitions right, because I think there's been quite a expansion of what this actually means without our definitions being clear and where the contribution that different fields can make is recognised. So I think that's a good question.
Great. Great, the questions are rattling in. I think Pam, you had, and then Simone after that, and then we'll probably have to wrap up because we've got another session. Over to you, Pam, if you could be concise, please introduce yourself.
Yeah, Pam Hubbock, I'm at the University of Exeter and a Youth Access College Fellow as well. I do research on marine citizenship, so kind of behaviour change, certainly in all the different ways that you might approach what behaviour means. You mentioned at the beginning about values, and you've obviously challenged knowledge deficit, applaud all of that. But I'm wondering about where you fit identities into this and identity processes, because that's one of the things in my own research that's come out as being quite operational, so I'd be interested to kind of see how that's situated.
That's a good question. We haven't really discussed that, have we? George?
Yeah, in Cardiff University. Strangely enough, years ago I was in the social identity group at Bristol, which has its background, which we won't go into. But we do have Steve Reich here at St Andrews involved in that, and he's one of the social identity researchers nationally known. So I mean, and also Anthony Nitz from UCL, who is our EDII champion very much so. So I think from that perspective, identity won't be overlooked in this. Can I just make one as a comment that I was, Linda's right to say that I've kind of dropped out of the pandemic to some extent. I guess the thinking was in government and in the ESRC that kind of a need was suddenly found for social scientists, even though maybe we weren't heard quite as well as we should have been heard at the time, and therefore, what would that mean for the field more generally? But Linda's given a couple of good examples. The reason why I was attracted to it was you can take stuff that's been gone around in health research, for example, and some of us in the environment community are starting to ask the same question or working with the same gnarly type of problem. And so, what's the crossover between these different fields, which often don't talk to each other? So, I recognise loads of people in this room, and only a few of you have a contact with health, like me as well. So that's some of the excitement, is to bring some of the learning that's come from these other disciplines into the environmental domain, from my perspective, and the others involved in their areas. But to answer your question, no, it won't.
Okay. Thank you for that. Simone, how brief can you be? There's a challenge. Question and answer.
Well, yeah, I mean, I guess it's...
You could just introduce yourself.
Sorry, yes, Durham Energy Institute, Durham University. I think that maybe some of the questions and the challenges come from your introduction, where you said behavioural science could be all social sciences, but clearly it isn't. It's a very particular sector of social science. And I wonder whether it would be better if we were a bit clear about our definitions, about the limitations of our approaches, because actually I think probably quite a lot of people here would feel that particular approach is one they would normally challenge. So I just wonder how you, when you're, for example, cognitive policy and you're very keen to present a united front, how do you define the limitations of what you do in relation to other approaches that other colleagues might have taken?
Yeah, I mean, this is the question actually I thought this group would ask, so it's just Simone, it's a really, really good question. I think we have to be very clear where we contribute and where we don't. So I lead another consortium which is on the commercial determinants of health, so looking at the activities of industry, totally different disciplines in many ways in that group. That's just one example. So I think we can say, what's the challenge you're facing? Is there a behavioural element to it, either individual or organisational? Are there theories and concepts that we could draw on to help you think about that? And if not, well, it's a different question. It's more appropriate to have a sociologist or an economist from a completely different part of economics contribute. And a number of us are in roles where actually part of what we do outside of this initiative is to say, well, how can we connect decision makers with academics from a broad range of disciplines, the right groups to answer the right questions. And so I think we need a broad church, and we need to stay in our lane to a certain extent in doing that.
Okay. Thanks very much indeed, Linda. I'd like to close with it.